Hello, everyone. First of all, thank you very much for your interest in my research. My name is Gábor Schering. I am a Marie Curie Fellow at Bocconi University in Milano, Italy. And my presentation is about the health consequences of labor market disintegration, specifically about deaths of despair and deindustrialization in post-socialist Eastern Europe, trying to tease out some theoretical insights for other cases experiencing similar disintegration and deindustrialization in Western Europe and the United States. So probably most of you have heard about the deaths of despair, the expression deaths of despair, which has been popularized by Ann Case and Angus Deaton. And it describes this really, really worrying trend of rising working class mortality in the Rust Belt of the United States, which has been going on since at least the 2000s. And some argue that this is driven by dysfunctional culture. So working class people make the wrong choices because they lack education, lack the knowledge about what is healthy and unhealthy. Others argue that this is due to the very special circumstances, the liberal regulation of the availability of drugs in the United States. While others say that this is related to economic dislocation. So this would suggest that the United States is not that peculiar, but it's more about the structures of late capitalism and contemporary economic transformations. So this research enters this debate, whether it's about culture or the unique drug supply environment in the United States, or whether it is really related to the economic dislocations. And if we find similar processes in Eastern Europe, then it strengthens the case that economic dislocation, such as the industrialization, causes deaths of despair. And what we find in quantitative evidence is that indeed the industrialization is significantly and robustly associated with increased death rates in Eastern Europe. We show this for Russia in our research, with collaborative research with our co-authors, and also in Hungary using multi-level evidence. This is the right-hand side of the panel, which shows a higher level of industrial employment loss, the higher your mega chances of dying are, using data from 52 towns throughout Hungary's Rust Belt. So there is indeed a robust association. This is filtering out all the usual individual and town level factors. And there were no such differences in health inequalities before the industrialization hit this town. So we checked this also in the 80s. So this seems to be a causal association. And really what this presentation is focusing on is how this causal association really works. What are the mechanisms driving this process? So to do this, to analyze, to understand the details, we did qualitative fieldwork in 4 medium-sized industrialized towns in Hungary's Rust Belt, and conducting 82 interviews, semi-structured interviews with people who were living already in 89 in these towns, so that we can compare life before and after the post-socialist transition. But this resulted in a large body of qualitative textual data, more than 800,000 words long. And I've analyzed this using qualitative thematic analysis using the software NVivo. And because this is really a vast empirical body, in this presentation, I'm going to focus on the overall processes so as to really show what is going on. And the paper that I've sent around is a really long paper, also reflecting the depth of the empirical material. So sorry if you found it too long. So here I'd rather try to present a bird's eye view of the results. So these are the 4 towns, all previous socialist industrial towns in Hungary that experienced significant deindustrialization to varying degrees during the 90s. And to give you an overview of what has been going on in people's lives, this word cloud gives a summary of the way people talk about their experience with the transition related to health. And what's crucial here is that the interviewees, most of them workers, link their health to the neoliberal transition. So this implies, I believe, that researchers should do the same. We should take this context seriously. So although it's quite clear that behavioral factors, drinking, things like that are crucial, but then the really interesting question is, what are the underlying factors influencing these individual behaviors? So theoretically, the paper is built on the fundamental cause theory, which attempts exactly to do that, to unearth the upstream political and social and economic determinants of behavioral factors that affect health inequalities in the long run, even if knowledge on unhealthy behaviors accumulates, and even if the economy starts to grow, these upstream causes of health inequalities and ill health might contribute to health problems in the long run. And applying this theoretical approach and analyzing the deep structure of the interviews, we came up with a 6-mechanism model of deindustrialization as a fundamental cause of ill health, and the deaths of despair epidemic. So this looks really tidy now and symmetric and everything, but this is a result of a long empirical analysis of the interviews. So this did not exist previously. To get here, it took multiple occasions of reading and rereading the interviews, coding them qualitatively to capture the emerging themes, and then reading the literature, recoding, recasing the interviews, and then we came up with this understanding how the industrialization leads to deaths of despair. And what is crucial to see that there are both individual and social pathways. And the most obvious effects of deindustrialization that we might think of are the individual pathways, especially in material deprivation, job loss, and income loss. And individuals interviewers talk about this, of course, and it's very important. But what I believe is really the added value of this research is showing the other pathways through which deindustrialization might lead to ill health, such as, for example, work-related pressures. So even those interviewees who manage to keep their jobs very frequently talk about increased workload, increased precarity. So old-type industrial jobs were secure jobs, unionized jobs, whereas the new jobs emerging after the collapse and labor market disintegration, the new jobs that are emerging are less regulated, more precarious. If you think of the service sector, like in the West, people working in Amazon factories or delivery workers, these are much more precarious types of employment than old industrial jobs work. Social identities are also dislocated by deindustrialization. So for example, gender identities, male identities are tightly interwoven with the idea of work, and especially industrial work. And when industrial work disappears, the service sector jobs are less compatible with the old type of gender identities, especially important for traditional male identities that workers usually hold. Place identities are also crucial. So the way individuals define themselves is interwoven with the way they see the towns where they live. So as the industrialization erodes local services, people migrate out of these towns. Social and economic problems engulf these localities. People see themselves as locked into these areas of decline, and this also contributes to the erosion of their identities. Crucially, at the social or communal level, we observe an increase in inequality, income, racial, ethnic, and power inequalities. So, for example, by eroding trade unions, deindustrialization contributes to political inequalities. So erodes those resources that could be used to curtail inequalities. It contributes to income inequalities. You know, some of the jobs that are emerging in the service sector pay good wages, but there are empirical research that showed that service sector jobs tend to be more unequal than traditional industrial jobs were. Community services are eroded, especially in socialist Eastern Europe. Companies provided a lot of health, culture, care, and sports services. But even in the West, companies contribute to this through taxation, and the industrialization erodes these services. And finally, communities and social capital and families are also dislocated. The industrialization, job loss frequently leads to divorce, family problems, but also the dissolution of working class communities in these towns. So these can be seen as communal resources that could be used to cope with the stress posed by the industrialization. So the industrialization at the same time increases chronic stress, psychosocial stress, and erodes communal resources that could be used to cope with stress. And the long-term accumulating experience of being unable to cope with psychosocial stress leads to desperation, powerlessness, hopelessness. And this is what influences health behavior, leads to ill health, and finally, in some cases, deaths of despair. So this is the overview, and in the paper, we give a detailed quotes from the interviews to underpin this mechanism. Briefly, there are important similarities and some differences across the East and the West, trying to generate insights from the empirical material. Material deprivation, unemployment, real wage stagnation, work-related pressures, these are quite similar both in the East and the West. Also, the destabilization of social identities. There's a lot of research on this showing how workers both in the West and the East are negatively affected through the identity processes kicked in by the industrialization. Political inequality is also increased. Communities, the decay of working class communities, the loss of working class culture, again, large literature showing, and quite similar throughout the industrialized towns and areas both in the West and in the East. Same goes for income inequality, has been robustly linked to labor market disintegration, deindustrialization specifically. There are some slight differences. So of course, the macroeconomic context is different, but if you think of the transition from socialism to post-socialist neoliberalism, it's also kind of an instance from a transition from Fordist to post-Fordist capitalism. The industrialization was quicker in Eastern Europe and in many often more severe, but otherwise it's quite similar in qualitatively. And some aspects of the deaths of despair differ in the East and the West, whereas in the West, it's especially in the US, a lot of it is about drugs. In the East, instead of drugs, we can observe alcohol use, but also suicides, infarctions, and mental health related problems were very, very important during the post-socialist mortality crisis when the industrialization hit. Gender identities, the way they were impacted differs, because in the East, we observe a retraditionalization of gender roles a lot through the loss of care services and women withdrawing from the labor market. But in the West, it's rather a postmodernization of gender roles that we can observe in parallel to the industrialization. Racial inequality has many important similarities, but some important differences as well, because in the West, especially in the United States, you can observe really severe racial disparities, whereas in the East, sometimes we are talking about ethnically rather homogeneous societies, and it's the rural areas where you can observe a large share of Roma populations, whereas in the US, it's really urban areas where these problems are more severe. So to conclude the research, what this research has shown is that the industrialization is a complex mechanism with many important similarities and differences. It's a layered mechanism with multiple direct and indirect causal components. And these components reproduce ill health even as income grows long after plant closures. So this calls for complex research approaches and policy responses that are able to tackle the underlying fundamental causes of stress and despair through social and economic policies that are able to mitigate these problems. Thank you very much for your attention.